Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. And today I'm going to talk a little bit about oral contraceptive birth control pills for New Start, just some of the orienting information. This isn't exhaustive, it doesn't tell you all the information, it tells you a little bit about the risks and benefits, and certainly talk to your doctor again about your specific circumstance, your specific risks and your specific benefits. But in general, pills, birth control pills, have a lot of benefits and some risks to be aware of. So one of the benefits is they make your periods more regular, usually less cramping, less days of bleeding. They also prevent pregnancy. There's about a 1 in 50 chance of pregnancy if birth control pills are taken appropriately. They also have some benefits with reducing acne. They can help some with premenstrual syndrome, reducing that, the mood swings before your period. They also can reduce your risk of ovarian cancer. So approximately 10 years of birth control pill, or 5 years if you have two kids, older studies show, can reduce your risk of ovarian cancer by as much as 70%. And that's pretty significant. We're still not very good with ovarian cancer. Luckily it doesn't happen too often. The chances are about 1 in 60 to 1 in 70. However, if it happens, as high as 80% of women are not alive within 5 years. Now, some of those statistics will change with time, but the overall suggestion is correct. So they can also reduce non-cancerous benign breast tumors. What about some of the risks? Well, they can increase your risk of stroke, heart attack, blood clots. Those are pretty small increases, but they do magnify if you have other risk factors. For example, if you're over 35 and you are a smoker, you can't have birth control pills. Or if you have high blood pressure, there's differences if you're overweight, things like that. But just to put it in perspective, the blood clot risk for being pregnant is 3 to 4 times higher than being on a birth control pill. So those risks, relatively speaking, are very low. And if you're a low risk candidate, you could potentially have birth control pills till age 55. So one other thing that I want to say, well, a couple other things. Another is very rarely you can get something called a benign non-cancerous liver tumor. And so that's why part of the reasons you have to see your doctor once a year is so you get an exam and they feel your liver and make sure that's not enlarged. That's really a rare consequence, though. I've seen it 3 times in over 30 years. One other thing, when you first start the birth control pill, you need to know that it gives you estrogen and progesterone, most of them, and those hormones are what your ovaries make. And so when you first start the pill, you're getting too much hormones. You're getting the hormones from your ovaries, and you're getting them from the pill. And your brain thinks they all come from the ovaries, and I'm like, whoa, that's too much. The brain doesn't like it. You feel nauseous, you feel breast tenderness, you feel bloated, you feel like you're pregnant or like your period's about to start. And lots of women who hate pills or say, I tried them, I couldn't take them, they usually give up in the first few days or a couple of weeks because those are some of the symptoms, headaches, for example, as well. However, your brain, like I said, doesn't like it. Your brain says, hey, ovary, what are you doing? Too many hormones. It gives a signal to your ovary to stop making so much hormones. It shuts your ovaries off. They stop making hormones. They stop making eggs, ovulating, so that's how it prevents pregnancy. But then you're on a much more even amount of hormone and less. So that's when the nausea goes away, the symptoms go away, and things improve, okay? So you gotta get through the first couple of weeks of transition. Each pack will be better. Usually by the 3rd pack, you should be happy. If you're not happy then that's when you might wanna get back to your doctor. One other important thing to note, I'm gonna mention, is headaches. Headaches are a funny thing with pills. Some certain types of headaches don't go with birth control pills. Others can get better. I'm gonna touch on some, but you really need to speak with your physician about your case. Okay, so if you have headaches when you're on the pill, where you have visual changes, or you get migraines where you have visual changes, especially one-sided where you start losing, pill is not for you. On the other hand, if you always get headaches and you don't have this visual aura around your period time, there is a way to give you the birth control pill that can often make that better, to give your hormones even, and even to potentially take them continuously, which is a different way that you should discuss with your physician, that can eliminate your periods, eliminate those headaches, or at least make them a lot better. So I hope you found this helpful. Again, it is not exhaustive. I haven't told you all the risks, I haven't told you all the benefits, and I don't know your particular case. So they may not be appropriate for you, or they might be great for you. So talk to your physician. Hopefully you found this helpful. Let me know. Thank you.